Great, welcome everyone. My name is Stuart Shipp. I'm a senior advisory solution consultant for ServiceNow, working out of New Zealand, and I'm currently engaged with the GPC, the global partners and channels. So obviously done a few of these and trying to pick up different sort of capabilities. This is just the full capability map as it currently stands for ServiceNow. And today I was going to pick on the health and safety application. Again, just trying to put some knowledge and definitely some capability out there around pieces that maybe not everybody's aware of from a ServiceNow perspective, or areas that ServiceNow plays in. And ServiceNow's health and safety solution helps organizations proactively manage workplace risks and incidents through capabilities like safety inspections, risk assessments, job safety analysis, and audit management. And the integrated health and safety workspace offers an intuitive experience for capturing, tracking, and resolving safety events, including visual injury reporting and automated compliance documentation. And of course, we have our Now Assist for health and safety, which enhances the generative AI to streamline reporting, root cause analysis, and corrective actions. So the health and safety incident management supports a complete life cycle, from employee-driven reporting through to analytics and continuous improvement. The solution is looking to empower staff to report on incidents from any device, enabling collaborative investigations, streamlining root cause analysis and CAPA, corrective and preventative actions, and delivers accessible safety training content. And with the integrated analytics, organizations can reduce incidents, compare performance to industry benchmarks, and foster a safer working environment. So ServiceNow makes safety accessible to every employee through some of our usual capabilities, like the Employee Center, and of course the Now mobile app. And this is enabling quick access to health and safety knowledge and self-service reporting. So employees can log incidents, hazards, and near misses directly from their desktop or mobile device, enhancing responsiveness and frontline engagement. And this empowers a safety-first culture by making reporting simple, intuitive, and always available. And the Health and Safety Workspace homepage provides real-time visibility into key safety metrics and operational performance. So here users can track safety KPIs like DART, days away restricted transfer, TRIR, that's total recordable incident rate, LTIR, lost time injury rate, and yeah, do things like open instance by location, while also managing assigned safety tasks across individuals and team views. And this centralized workspace supports that proactive safety management, trend analysis, and then the accountability across teams. And the workspace also simplifies incident documentation with structured guided reporting for injury and illness cases. So employees and safety personnel can log injury details, the severity, the location, and treatment, while attaching supporting documents such as OSHA, which is Occupational Safety and Health Administration. Over here, we would use something like WorkSafe documents, but essentially geared towards your particular geo. And this intuitive interface ensures compliance, promotes accurate reporting, and improves response times by linking data directly to dashboards and safety KPIs. The risk assessments capability allows safety teams to proactively identify hazards across severity and likelihood and apply mitigation controls to reduce workplace incidents. And here users can assign corrective and preventive actions across departments and then track implementation effectiveness. And this configurable tool supports hazard libraries, control measures, and risk matrices tailored to organizational needs. We're also looking to make it easy to schedule, conduct, and track safety inspections through a purpose-built health and safety workspace. So the inspections can be executed from any device using mobile-friendly assessments and surveys, streamlining data capture and ensuring timely follow-up. And this flexibility boosts compliance, simplifies reporting, and reduces administrative overhead. We also have the Job Safety Analysis, JSA capability, which allows employees to document job tasks, identify associated hazards, and apply control measures through easy-to-use digital forms. And organizations can create standardized or personal job templates to streamline safety planning and ensure consistency across those teams. And the completed GSAs are stored for audit readiness, of course, and historical reporting, which then improves both your compliance and proactive risk mitigation. And we're also enabling that collaborative incident reporting investigation across the team. So supporting near-miss logging, RCA root cause analysis, and witness statement collection. So your CAPA, your corrective and preventive actions, can be assigned and tracked with automation to streamline routing, checklists, and tasks. There should be a forthcoming enhancement at the time of recording this that will allow direct export of incident data into those OSHA compliant forms for regulatory reporting. And ServiceNow streamlines the safety audit management by enabling teams to schedule reoccurring audits, define the goals, and assign required actions to relevant teams. And the audits can also be conducted via the mobile app, whether online or offline, ensuring flexibility and field readiness. And observations and results are then centrally recorded, which is helping driving your accountability and continuous safety improvement. And with all of our applications, we have Now Assist for health and safety, which uses generative AI to automatically produce instant summaries based on structured case data. And this enables faster and more consistent reporting while equipping stakeholders with actionable insights to mitigate future risks. And of course, by reducing those repetitive manual work, Now Assist improves productivity for safety officers and enhance the incident investigation quality. Just some outcomes and metrics that are always useful to have to hand. We're looking to update that total recordable incident rate, looking to improve your DART, your LTIR, your injury frequency, and just some of the suggested improvements that you can gain as a customer from that and implementing the health and safety solution. And ServiceNow obviously has all of our implementation plans and success packs that can be used when implementing our tool sets. So if you're a partner, you'll be able to help your customers using all of these predefined components. So now we're just going to dive into a little insight demo for health and safety, give you an idea of how all the pieces fit together, and peruse some of the main components so that you can tie the theoretical to the practical. Great, so we're going to start our journey with someone called Maria Davis, who are an employee, and they're working out of the employee portal. And this employee portal, as with all the other components, the big capability behind it is to introduce all the different areas, all the different departments, all in one portal space. So health and safety is no different, and we can build that out inside of that portal piece that they can go to. So let's browse to the health and safety. We can look into those, the different areas. We can set up our knowledge, right? Our knowledge articles, knowledge capabilities, all of our various widgets. I won't dive into all those components, but everything that you would assume is available in there. One cool thing with the Employee Center Pro is you can use microsites. So just click on one of these, and these can be built out basically sort of like an embedded newsreel slash document slash templates capability for each of the different segregations. So here's one example for health and safety. So we can embed safety news for our corporation. Maybe there's some video content that everybody needs to review, talking about first aid kits as an example where they are, important contact information. So Microsoft and record producers that directly push into the system. So microsites is a very unique sort of capability from the Employee Center Pro. So be sure to have a look at those. So let's go back into the health and safety. And again, this can be set up and branded how you'd expect to see it. And what we're going to do is browse a couple of these examples, and these are out-of-box templates that can be used, obviously updated to whatever you need for your particular examples. The first thing we're going to do is have a look at this report health and safety. So, maybe there's a crack in the building, a broken pipe in a room, a fuse issue. And these are used so you can capture issues before they happen. So let's click into one of these. And you can put together various sort of categories. Let's choose electric as an example. Is it good? Is it bad? Is there a hazard? So let's pretend we're getting a hazard. And these can be set up to drive from particular locations. So you can drill down to whatever you have built out, particular room, particular floor, and all of that metric areas so people know where to go, what spaces is involved in that. We can set up this to talk about, who's involved, is it particular people? And there's also a contract management tie into this. So you can actually govern your contractors, which is quite a big piece for our customers. So the contractors can get registered. We can say what work they're involved with. And once they've been registered and they've got the people, all of this health and safety can then be run across your contractors as well as your employees, and also things like your visitors that go into that. So here's an example, right? Like a live sparking use loud slopes. We had attachments, and again, if you're using a mobile, you can take pictures and submit those as well. So there's just an example of that. Okay, crosscode. Hopefully that doesn't affect the demo, but let's keep going. And then the usual piece that once you've submitted these elements, you can come back into the system. You don't have to call people up. You can look at the activity that's going on, what's happening for it, any feedback from one place, so you can reduce kind of calls and emails backwards and forwards to go into it. So let's go in and have a look at some other ones. What other examples have I got in here? Yeah, so maybe it's a job safety analysis that you want to look at. So this might be for employees in a hazardous job. They just describe the job they have. They can configure job templates that will describe and pre-fill. But basically they want to build one out so for those controls and the control mitigations in the job steps can be covered to make sure that people are safe. So let's just put in some details here. It doesn't really matter, but you have a location. It's PSA. It could be a particular job. And these are the predefined templates that you can create. And I'll just select one of these and we can see the pre-fill. So you don't have to build out the job steps, hazards, and controls every single time. So hopefully, yeah, great. So adding that in, we can see the job steps and we're going to have a look at those in a second. Let's just give this a, when am I doing the job? When's it ending? And then we can go into these job steps and hazards. And we can obviously add our own steps. We can build them from scratch as well when we're building the template. There's a loading step as an example. Next. And all of these hazards you can hide and remove. You can have psychosocial, could be ergonomic, safety, physical, right? There's a lot of out of the box, and as I mentioned, you can send these active or inactive depending on what you're doing. So let's say, right, we've got inadequate protection for this particular job, and then how are we going to control? And so again, these are all interchangeable, configurable, so you can turn them on and off. So actually, we want to make sure that they've got protective clothing, right, that goes into this particular job. And you can build this out, so you get a full list of, what are the potential hazards, and then how are we going to control and get around those to minimize the risk. So that's part of your JSA. And you can build that out, employee workers, provide remarks, attachments, and so on. So there's an example of submitting JSA. And as I mentioned, you could obviously easily do this from a mobile also. Great. So now let's go back and we'll fill in one more piece so that we can run on the back end. It's sort of a typical example. So let's do a medical instance. And in this medical instance, Maria's seen that Emily Scollin has slipped from a ladder and injured herself. She's already pre-filled who the person is involved. We could add contracts, right? We can add a selection or a location. You don't have to do these, up to you what you make required or not required. And we're going to submit that. And then we're going to join into the backend. Apologies for the cross-scope issue there. Hopefully, again, we keep going through. Yeah, so that will be the portal component. Oh, one more thing I'll show you is that contractor management that I quickly mentioned. Obviously, I haven't built this completely out. But if I go back in as my power user, yeah, great. So just talking about that ability to manage your contractors, just gave a simple example in this demo. You can click in, a contractor company could come in. You can be various fields or whatever you want to put in there, right? They can register themselves, road maintenance, industry type, maintenance, that'll do. And then they can add contacts and descriptions. So there's a way for those contractors to register themselves. And as I mentioned, a process behind that where they get accepted, the people get accepted, and then you can start covering them in your health and safety application as you do your employees and your visitors, etc. Okay, so let's go into the backend. And this time I'm going to impersonate Mike. Mike is basically a health and safety team member. And he typically works from the health and safety workspace. So in these ones, I don't go through. I assume audience has quite a good understanding of how the platform capabilities serves now. But our workspaces, those usual, all the right data, all the right elements shown based off of persona and to what I should be working on, and in what order that goes through that. And you can build these out and configure them, right? So we can look at different metrics. You can apply those KPRs, the DART, the TRIR. And build those out as you go in to make sure that this is applicable to whatever you're doing. So just zooming through the main components, you've got your incident management piece. So we can look at all our safety incidents, safety observations, any injury and illness, and we'll come back and run through one of these in a second. And these list views, as always, configurable, data only visible to people you want it to be visible to. And then we have our JSAs, so there's job safety analysis. So we can see the one that I was chucking in there. I'm just going to open this one up because it's got some data in it. So this will kind of give you the start and end times. It'll talk about, what were the hazards and what were the control measures are in there. People have been briefed. And then this can be obviously run through and worked on dependent on what you're doing as part of your day-to-day. Then we'll take a look at the next one here. On the left hand, just going down, we have our risk assessments. So these can go out, high-level risk assessments. They could be in review and approval processes. You can identify who's making contributions, who's been impacted, who's at risk, who's going to create the roles, etc. So let's just jump into one of these. Get an example. So here we go, right? There's a construction site working at heights. So the assessment concerns workers working in a manufacturing plant, looking at safety controls to be overseen. So then we can look at some of the risks and controls that are associated to that, right? So here, let's look at one, falling stock from racking. And as you would expect to see, what's my severity before I put my controls in? What's my likelihood before I put my controls in? And then the control measures that we're adding and associating to that. And then what are the severity and likelihood after our controls going in? So just a typical kind of risk analysis and risk and control component. And then we can also associate our risk actions. So what's actually happening to this, right? How are we doing and what are we working on? So we're going to create, this one's a preventative. So we want to prevent those risks. So what are we doing? We're installing guardrails, we're installing safety nets, right? So you're getting your audit, your compliance, and your life cycle and your tracking that goes through that. And then on our next list now, we've got our inspections. So you can set these up. They can go out based off of sort of time schedules, well they'll go, right? You want to see what was found on those inspections, and then what was any kind of follow-up that you need to do on it. So I'll just pick a random one here. Again, apologies for the cross-site error. So this one's the safety inspection, so a periodic safety check for crane equipment that's gone through, and there's particular assets that's being tracked around those crane equipment pieces that are part of this. And then this could be a survey. So here we see the survey that was used for this. What were the answers? What were the details that came back? And then again, we're tracking the findings and what are the root cause analysis of this one. So here we've seen, an issue with the belt idlers were found doing an inspection that goes into that. And while we're on this one, I'll talk about the 5 whys. So the 5 whys is a simple yet powerful sort of technique used with root cause analysis, RCA, to identify the underlying cause of a problem. So the method involves basically repeating asking the question why, usually 5 times, to drill down from a surface level issue down to its root cause. So it's kind of like an iterative question. So example, right, is why did the machine stop? Because it overloaded. Why did it overload? Because the bearing was not lubricated. Why was it not lubricated? Because the lubrication pump was not working. And then why was the pump not working? Because the shaft was worn out. And why was the shaft worn out? Because there was no filter and metal scrap got in. And then the purpose off the back of that is basically the 5 whys is helping organizations to address the fundamental cause rather than just treating symptoms and the idea of preventing recurrence of the problem. And then the ICAM RCA, so ICAM stands for Incident Cause Analysis Method. It's a structured and systematic approach to investigating incidents, particularly in safety critical kind of industries. So an example like ICAM steps, the first one, immediate action, which could be, secure the scene, ensure safety. Step 2 could be investigation planning, define the scope and assemble the team. 3 could be something like data collection, gather all the relevant information. 4, data organization, sort and categorize data. 5, data analysis, identify failed or absent defenses or any contributing factors. And 6, recommendations and reporting. So develop corrective actions and report findings. So basically, ICAM is aiming to identify both active failures, those human errors, and latent conditions, so systemic weaknesses, to prevent recurrence and improve organization resilience. That's going to show here. So yeah, and the contractor piece, as I mentioned, and there could be approval processes and various kind of setups that go into this. But this is an example, right, of these companies, the detail of the company that you're accepting as a contractor, the workers that are associated with it, some simple things like ratings you can start to do in their documents, and particular sites. And again, this ability then allows you to cover your contractor workers inside of your health and safety component in ServiceNow. I'll leave that one. And then, so as I mentioned, configuration. So all those, if you remember from the pop-ups, the hazards, the control measures, safety registers, you can all build these out directly from the workspace, which is obviously making it a lot easier to administer that and build it out as you go forward. So quite a few kind of capabilities are built here without having to necessarily go into the back end to deal with that. So let's go back and just run through that health and safety incident, the one that we submitted for Maria Davis, and I think it was Emily that fell down the ladder. So here's an example of running through those. And out of the box, again, this has a playbook. Hopefully you're familiar with playbooks. You can turn the playbook off, obviously, if you don't want to do it as normal. Add fields, configure this based off of what you need to adhere to your company's process and setup. But we just run through this. So the out of box one, if it's come through from that record producer or the portal or from the mobile, we're automatically pre-mapping those details onto the record, and you can fill this out with more information if you want to. For the sake of this demo, we'll just say that looks good. We've got most of the things in here. So we're going to mark that as complete, and it should then push us on to the next bit. We already know that Emily's involved. So here's an opportunity now, add more people, right? Injured parties, safety teams, any witnesses. They could be employees, they could be contractors, and you can add more of those into it. So I don't know, let's just pick someone. And Clark. Add Adam as well, and you could build that out based off of what you've collated and brought up inside of this investigation. And then we're moving on to the injuries. So the detailed information about the injury, what area of the body was injured, did they go to hospital, were they treated? And we can track all of this on a particular form called an injury form. So I open this one up as an example. And lots of nice out-of-the-box features here. We can redact information or take off sensitive content, start recording, what was the treatment, who provided the treatment, did they go to the emergency room, were they hospitalized? And this recordable piece is when you create or generate these reports. So it could be OSHA or here, the WorkSafe report, which I'll show during this demo. You need to select that so that the relevant information can be mapped to the template. And more details on what's being provided. Was there unfortunately a death? Was there first aid only? What was the injury type? So on and so forth, and building out all of that information. And some pretty nice features here. So maybe they've realized, right, okay, we've identified a few injuries already. It's the ankle that's been injured, but actually we've come back in and realized that there's so I'm just reloading that, it's not loading up. There's actually more injuries. So maybe she's dislocated a shoulder, so let's highlight that. The shoulder, dislocated shoulder, and in, and we can add those in. So now I've added the in. If I go back to my injuries, we can see that has also been added into that. It goes into it. Ready? We've built out all of our injury components. We can now generate that report. So as I mentioned, it could be a specific template. So I've got the WorkSafe template here. So I'm just going to select that. We're going to generate it. That should then get attached to the record, which is good. The demo gods are still with me. And let's just take a look at this. And you can build out these templates however you like. Like I said, I've just done for this demo the WorkSafe one, and it can map in all the relevant details, right? So that's automatically taken care of and located on your incident report. So you've got a full kind of audit trail, when it was created, how it was created, the details that were added to it. So we're happy with our, not happy, probably not the wrong phrase, but we've completed the injury and illness section. There's also a section out of the box, as I mentioned, think about, is there particular assets that you need to map into this, right? So if it's a bit of kit or a bit of equipment, there's the possibility of adding those in. We're fine for this demo, we'll go through that. And then when we're ready, we move into our root cause analysis. So, what actually did we analyze from this? What was the outcome? And if you remember, we're talking about the 5 whys. So, first why, the ladder were not placed in the usual location. Emily was then in a hurry because she couldn't find the proper ladder. And that's because she wasn't properly trained. She's a new employee and someone placed them in the wrong location. So the root cause, Emily followed incorrect protocols because the safety team had not yet created or published safe ladder training and safe forklift training. And the team was unsure how to create the content and where to publish it. So there's the outcome, right? And then to mitigate that, we need to make sure that an action is taken and those areas are fixed. And then just very quickly, I did mention it, so I'll show you. If you don't want to use the playbook, you can come into the basically it's a health and safety administration component, and you can simply flip that. So thanks for that. I hope that gave you a good overview and insight into the ServiceNow health and safety elements. Obviously, I didn't show everything, but yeah, look forward to seeing you succeed with your customers and your companies using ServiceNow health and safety. Thank you.